Hello, my name is Dr. Charles Moore. I'd like to talk to you about the COVID-19 pandemic. COVID-19, which is caused by the new coronavirus, has been dominating the news. However, you may have first become familiar with the term coronavirus during the severe acute respiratory syndrome outbreak in 2003. The severe acute respiratory syndrome is also known by the acronym of SARS. Both COVID-19 and SARS are caused by coronaviruses. The virus that causes SARS is known as SARS CoV, while the virus that causes COVID-19 is known as SARS CoV-2. There are also other types of human coronaviruses. Despite their similar name, there are several differences between the coronaviruses that cause COVID-19 and SARS. So what exactly is a coronavirus? Coronaviruses are a very diverse family of viruses. They have a large host range, which includes humans. However, the greatest amount of coronavirus diversity is seen in bats. Most of the time, human coronaviruses cause mild respiratory illnesses like the common cold. A new type of coronavirus can emerge when an animal coronavirus develops the ability to transmit a disease to humans. When germs are transmitted from an animal to a human, it's called zoonotic transmission. Coronaviruses that make the jump to human hosts can cause serious illness. This can be due to a variety of factors, particularly humans' lack of immunity to the new virus. So what is SARS? SARS is the name of the respiratory illness that's caused by SARS-CoV. The acronym SARS again stands for Severe Acute Respiratory Syndrome. The global SARS outbreak lasted from late 2002 to mid-2003. During this time, about 8,000 people were sickened and 774 people actually died. The origin of SARS-CoV is thought to be bats. It's believed that the virus passed from bats to an immediate animal host, a specific type of cat, before jumping to humans. Fever is one of the first symptoms of SARS, and this may be accompanied by other symptoms such as cough, fatigue, body aches, and pains. Respiratory symptoms can worsen, leading to shortness of breath. Serious cases rapidly progress, leading to pneumonia or respiratory distress. So, how does COVID-19 differ from SARS? COVID-19 and SARS are similar in a lot of ways. For example, both are respiratory illnesses caused by coronavirus. Both are believed to have originated in bats jumping to humans via an intermediate animal host. They are spread by respiratory droplets produced when a person with the virus coughs or sneezes, or by contact with contaminated objects or surfaces. They both have similar stability in the air and on surfaces, and they can lead to potentially serious illness, sometimes requiring oxygen or mechanical ventilation. They can have worsening symptoms later on in the illness. They can affect the elderly, as well as those in underlying health conditions, and we are seeing that there are a number of African Americans in particular and people of color that are being disproportionately affected by this because of underlying health conditions, but also because of structural racism that impacts these factors as well. So how are these two different? How is COVID-19 and SARS different and similar? So as I've just discussed, they have similar types of symptoms, which can be fever, cough, fatigue, but you can also have body aches and pains, headache, and shortness of breath. What seems to be newly found out about COVID-19 is that you can also have diarrhea, which is a little bit, you can have that with SARS, but a specifically different feature is the loss of taste and smell that has recently been added to the list of potential symptoms that someone presenting with a COVID-19 infection can present with. How is it transmitted? COVID-19 appears to transmit more easily than SARS. One possible explanation is that the amount of virus or the viral load appears to be highest in the nose and throat of people with COVID-19 shortly after symptoms develop. This is in contrast to SARS, in which viral loads peaked much later in the illness. This indicates that people with COVID-19 may be transmitting the virus earlier in the course of the infection, just as their symptoms are developing, but before they begin to worsen. So there's a few key factors that I'd like to point out. The first is that this infection with COVID-19 can happen to you. As I mentioned, COVID-19 is disproportionately affecting African Americans, but everyone can be impacted by this. Physical distancing helps prevent the spread, and that's a critical thing for us to remember. The virus moves from person to person very easily, and you can't see it. So people who don't have symptoms may actually be carrying it. They may also appear healthy, but they can still spread the virus. You will have no way of knowing that. So it's important to stay at least 6 feet apart and to wear a mask if you can, and encourage others to do the same. And if you're, for example, in an organization where they have one-way signs directing your path, follow those signs, because that will tend to decrease your likelihood of coming into contact with another person. Every time you come into contact with a person, that's a potential exposure to the virus. Wear a mask in public, a mask like this or a similar mask, because my mask protects you, your mask protects me. This is one thing that we'll really have to continue to do until a vaccine is found that is effective, and then until the time when we have enough people that are actually taking that vaccine. Your vaccine needs to cover both your mouth and your nose. So this entire area needs to be covered. If you're closer than 6 feet, you need to wear a mask. Hand washing is still the best thing that you can do. Soap and water is really the best, and you should wash your hands for at least 20 seconds. Some people like to sing happy birthday twice. If you sing it more than 20 seconds, that's fine. Make sure that you're washing all the surfaces. So the palm here, in between the fingers, the back of the hand as well. Again, for 20 seconds. You can also use hand sanitizer. The key with that is that you need to rub it all over your hands in all those areas that I just mentioned, but rub it until it's completely dry, because the hand sanitizer is only fully effective when it's completely dry. Also know that testing is now available, and really pretty much every city there will be a location where you can get testing, which can be done without a fee. And if you feel that you're sick, you can call the COVID hotline, which is 844-442-2681. If you have other medical conditions, don't delay getting medical care. It's important that you go as soon as you know that there's a problem, because the longer you delay getting care, then that can make that initial problem worse and lead to other things. And lastly, just stay encouraged. We will get through this if we work together. That means washing hands, wearing the mask, keeping 6 feet apart from each other, doing everything that your public health professionals recommend. But stay encouraged, we'll make it through this. My name is Charles Moore. I am the Chief of Service in the Ear, Nose, and Throat Department at Grady Health System. I am also the Director of the Emory Urban Health Initiative and the President and Founder of the Healing Community Center, which is a federally qualified healthcare center in West Atlanta. As many people know, we are in the midst of a pandemic, And in order to stop the spread of the coronavirus, there are several things that can be done. The first is to wash your hands with soap and water for 20 seconds. If you don't have access to soap and water, you can use a hand sanitizer covering all the surfaces of your hand and rubbing those hands until that is completely dry so that that hand sanitizer is fully effective. The other thing that can be done is physical distancing so that you're maintaining at least 6 feet apart from each other, especially when you're out amongst crowds, and wearing a mask. What the mask does is it prevents the likelihood of spread from one person to another, so that when I wear a mask, I protect you. When you wear a mask, you protect me. And if we all wear masks, we protect each other. And when you see me out wearing a mask, this is what you should think. Why is he wearing that mask? That's because I respect you. I respect your past, I respect your present, and I respect all the possibilities of your future. So in particular during this time, when there are so many issues that need to be addressed, when we have peaceful protests that are going on around the country, we need to really think about what do we need to do so that we can effectively get our voices heard, because we need to work together to reform and to reimagine this country. One of the things that we can do is respect each other, and we can start that by wearing a mask.